commonly used arterial line sites. Most commonly used sites for arterial line in ITU are the radial artery, the brachial artery, and the femoral artery. Very rarely we use dorsalis pedis artery. And also doctors maximum try to avoid femoral artery because of infection reasons, because since it is located very near to the perineal area, there's a high chance of getting infection. Therefore, doctors always prefer to insert arterial line either in the radial or in the brachial. Advantages of having arterial line. With arterial line, we can continuously measure the blood pressure, and also it gives the greater accuracy of the blood pressure, and also it gives visual display of the waveform. Arterial line gives us the measurements of MAP, which is mean arterial pressure, which helps us to titrate and stop the inotropes such as noradrenaline.
What are the hazards and complications of having arterial line?
First of all, any foreign bodies, including arterial lines inserted into the human body, that can cause infection. Secondly, occlusion. When the arterial line kinked or blood get clotted, it can cause occlusion and it leads to poor perfusion to the extremities. Also, it can cause air emboli when air pushes into the arterial line. And also, in case if it get disconnected when it is not visible, that can lead to massive hemorrhage, and that could be chance of user error. When the transducer is not placed in a proper level, it has to be in a phlebostatic level. When it is not placed in a correct position, it can lead to inaccurate readings.
Okay, Hermes, now let's go to the next section. So explain to me the normal and abnormal arterial waveform.
Normal arterial waveform. Y-axis is pressure and the left x-axis is over time. Left ventricular contraction causes a surge in pressure, which gives us a systolic phase. When left ventricular contraction ends, aortic valve closes. That gives dichotic notch. After aortic valve closes, left ventricle relaxes. That causes downward trend in the pressure. That's called as diastolic phase, followed by the left ventricular contraction again, and the cycle continues. Upstroke of systolic phase usually uninterrupted, but resistance can cause anacrotic notches. Example, in patient with aortic stenosis, we could see anacrotic notches. And arterial swing indicates hypovolemia, and straight line mostly is an equipment error.
Thank you, Hermes. Yes. Fantastic answers, but don't forget your dampen trace. You see a good lovely upward trend with a dicrotic notch, but then in a dampen trace the traces are very small and you can't find a dicrotic notch. You know that the pressure bag, there's less pressure in the pressure bag, or the normal saline is almost empty. Also, a dampened trace could be due to a pulseless electrical activity, or in a phase of a cardiac arrest you might have a dampened trace. Just make sure your lines are flushed. How does a transducer work?
The difference of pressure between the transducer bag and the arterial pressure converted into electronic waveform by a little thing called diaphragm in the transducer, and also it gives us a digital number.
Next question now is the reasons why do we remove the arterial line?
When there is a suspicion of infection, when we do not need arterial line anymore. For example, when the patient is hemodynamically stable, when the patient is no longer in need of any inotrope, when the patient is ready to go to the ward, we remove arterial line even if the arterial line is not working, or if the arterial line got kinked. After changing the new line, the old arterial line can be removed.
That's a good answer, Hermes. Just to add up to it, don't forget, if you have any kind of peripheral vascular disease, or if the patient is very cold and there's any perfusion issues, yes, the arterial line would definitely come out.
In order to remove the arterial line, we need the sterile gauze and the tape, preferably dynaplaster. And also, most probably, the arterial line always will be sutured. So in order to remove the sutures, you need a stitch cutter. And also, it's better to have a sterile sheet under the patient arterial line side in order to prevent soiling the bedsheet. Once you assemble the equipments, the first step is cutting the sutures with a stitch cutter. Then when you are removing the arterial line, wait for a single drop of blood come out of the arterial line side in order to avoid pushing the blood clot into the vessels that can cause thrombosis. And also, once you remove the arterial line, apply pressure till bleeding stops. Once the bleeding stops, put a tight dressing over it, and the dressing stays there for 24 hours.